Do you find that there's demand? So there's kind of two aspects. Technology typically advances based on demand in some regard, right? And so it's either the engineers demand and want to use the technology, it's the consumers, the end user demands and wants kind of the better experience, better technology, whatever it is, or the users of the technology that are delivering it, in your case, doctors and medical professionals, demand that better technology. So we've talked a lot about where the nurses and the doctors get benefit from some of this emerging technology and how it's actually easier to roll out. Is there any pressure or demand for pushing that even further from that cohort, or from the consumers themselves saying, hey, I want to be able to chat with my electronic medical records. I want to be able to have a pre-screening with the chat GPT doc, right? Doc edition or something that knows all my medical history and all my medical data. Or is it really just kind of the medical professionals that are advancing this currently?
I I would love to say that the increased use of this technology and stuff is driven by patients. But I don't have any research related to this or anything like that. But I think it's really driven more by the healthcare practitioners in trying to do more for the patients. And one of the reasons I say that is because unfortunately here in the America and somewhat to the rest of the world, we're not very cognizant or aware of our health. We're not very good at caring for ourselves, unfortunately. Particularly here in the U.S., it's the healthcare system is broken. It's based on being sick, not being well, and that needs to change. And it is slowly changing. We are moving from a fee based where you're sick, you get paid, to a value based. Where the doctor.
How is it changing? I'm curious.
Yeah.
Yeah.
So, in a sick-based system, the doctors, hospitals, health systems are all incentivized, to care for you when you get sick, because that's how they get billed. You go to the doctor, I have a cold, I scuffed my knee. Okay, there's a billing code related to that, and that's how they get paid. It's like, I saw this patient. I did, you think of a hospital, you go to the hospital, you stay for a couple days kind of thing. It's like, and they make all sorts of money. Um, from a patient side, a lot of that's hidden from you. You can't do price comparisons. What other industry out there can you not go to them and say, okay, I broke my finger, fix it. How much is it going to cost? They can't tell you, which is insane, quite
That's
frankly.
wild.
And there are new laws on the books that hospitals, health systems have to publish this information. It's slowly happening, but it's incredibly complicated because you can go to the same doctor at the same hospital, and depending on your insurance that you're using or the company you work for, get different charge differently. So publishing that pricing list makes it really interesting. And because the system is not incentivized to just improve general wellness, it's the patients really aren't driven either to care about their health and wellness. And so even going back 2008, 2009, we were part of a project that was looking at personal health records, as they were just coming about. And a lot of research, and it was project run out of Vanderbilt University. And there were a whole bunch of people to talk about this. And we had meetings with the Microsofts and the Googles of the world. And what is a personal health record? And we did a lot of research. And a lot of patients were like, yes, I want my personal health record. I want my data. I'm even willing to pay for it. But then reality strikes and nobody wants to pay for it. Very few people are using it. It is complicated, your healthcare, so I can't blame them either. But managing all that data is really hard. So we got to turn it on its head. And so healthcare is moving from that fee for based sick care to value based care, which is where doctors, health systems are incentivized on the overall health of the population. So that is slowly changing. but there's a lot of incumbent players in there, holding on to the way the world is today.